Hello, everyone. Welcome to today's information session hosted by the MPH program in Health Systems and Population Health at the University of Washington. My name is Lauren Sikowski. I work with this program as well as a few others in this department. I'm excited to share some details about the program and then answer any questions that you might have. Oh, and then also I want to share that you can see it right here, but this is our agenda. So we're going to talk about the program itself, like the format, curriculum. We're going to get into the major projects, career outcomes, tuition and funding, and then last I will talk about admissions and the application process, and then we'll go into Q&A. Okay, let's go into it. So the mission of this program is to train leaders in the field of public health. And our students, they gain analytical and practical knowledge and skills for improving health in diverse communities. They learn to find a common language to identify and address public health and population health issues and disparities. They identify approaches, methods, and principles to improve the public's health and the effectiveness of healthcare and population health services in the United States. And they leave with an understanding of the means by which social inequities generated by power and privilege undermine health. Our average cohort size is about 38 students. Sometimes it's, as many as 45 or more students, but our goal is about 40, 45 students. And our acceptance rate is about 71% in recent years. So now a little bit about our faculty in this program and the MS program. They're very closely linked. They participate, collaborate, and lead a variety of organizations and associations outside of the UW. They work with these relationships, and they can provide additional experiences and opportunities for their students. And they also serve as faculty leads and site supervisors for Practicum, Thesis, and Capstone projects, which we will talk about in a little bit here. And then I have some numbers for the amount of our current core faculty, adjunct, affiliate, clinical, and emeritus faculty. If you're interested in learning about our faculty, you can certainly follow the link at the bottom, and you can sort of like filter through them. And we will get into admissions at the end, like I said, but you don't need to do faculty interviews for this program. But some people, that's an important part of how they research programs. They want to know who they're learning from, what type of work do they do in public health. So that information is available. I also want to note that we are one of several Master of Public Health programs in the University of Washington School of Public Health. So in this top yellow box here, these are programs in the Health Systems and Population Health Department, the first one being the one that we're talking about today. We also have the MPH and Community-Oriented Public Health Practice and the online MPH program, which is fully online, no in person. And then there are, like I said, several other programs across the other departments in the UW School of Public Health. So if you're still in that shopping process, I've shared links to go to all of their pages too, and their emails for the people to reach out to if you have questions about those programs. There's not like one info session that covers all of them. You just kind of like learn about each one and apply to the one or more that sound good to you. And yeah, you can apply to, in a given like application cycle, you can apply to more than one program. They're just all going to have different applications, different admissions committees, different application fees, maybe different application deadlines. So that's just something to keep in mind. So now a little bit about this program in the greater UW ecosystem. So, like I said before, we live in the HS Pop department. Lots of faculty, over 400 faculty, 3 research centers that live in our department, 2 research collectives and collaborative groups, and we also have an HS Pop student group. And then if we go wider in the School of Public Health, I mentioned we have 5 academic departments, over 40 research centers and institutes. And there is a lot of interdisciplinary work going on. So you don't have to just be too tied to one department. Like you're welcome to Be a student in this department, but maybe work in another research or public health center that's held in another department. Yeah, and we do have faculty that work across the School of Public Health and faculty that work even more broadly in the UW. But I'm getting ahead of myself now. We also have 10 student organizations in the School of Public Health. I'm not reading out this whole slide just for the sake of time. And then we also encourage our students to join public health organizations and networks just for more networking, more opportunities to meet people and get yourself out there while you're part of this, part of this program. And then the MPH Common Core. So those MPH programs that I mentioned before, I'm going to go back a couple slides. Oops. So the MPH Common Core, what that is, I'll get into the classes that are involved, but just know that this program that we're talking about today, the MPH in Health Systems and Population Health, as well as all of these ones in the bottom box, are part of the MPH Common Core. Now, our other two programs in this department are very unique in how they do their classes. COPHP, they do all of their classes together as a cohort because they're all 100% problem-based learning. So all of their classes are together, and then online MPH, since they're online, they don't mix with the other programs because they're not in person. But their curriculum is still very close to the Common Core. And I realize without context, that just kind of sounds cultish, but I will get into what the Common Core actually is and means in a sec here. But back to where we live in the UW. So I mentioned that we have our faculty work across the School of Public Health. They also work across, like in other schools. Like some of our faculty also teach in the School of Medicine or the School of Nursing or Pharmacy or Social Work. The list goes on. And then we have a lot of partner organizations outside the UW that we work with very closely, and our students sometimes work with, and those are listed here. And again, for the sake of time, I have to move, but I just wanted you to have this information to reflect on, in those slides later if you like and you want to look into these. You can also find this information on our funding page. Okay, so the format of this program is full-time and in-person at the University of Washington Seattle campus, which is our main campus. There's no online learning component to this program. And our program is 2 years or 6 academic quarters, and 63 credits are required to earn the MPH. And that involves 25 or more credits from graduate level in classroom courses, 4 credits of your practicum, 9 credits of capstone or thesis, which is your culminating project. And then we offer 3 tracks or concentrations. We have the Generalist, Social and Behavioral Sciences, and Health Systems and Policy. So all students in this program apply directly to one of these 3 tracks or concentrations. And I will get into the details of what those are in a second here, but I just want to say that say if you apply to the Generalist, but then you realize, oh, wait, I wanted to be in social and behavioral sciences, you can do that. You just need to do it by winter of your first year in the program. So even though you apply directly into it, you're not necessarily stuck if you realize you made a mistake. But so getting into the definitions of what those concentrations are, let's start with the Health Systems and Policy track. So with that one, this is for students who seek a career of leadership in public or private efforts to improve the performance of the health system. They become well-grounded in public policy development, health economics, law, and ethics. And they acquire a deep understanding of how and where public policy is developed, what forms it takes, who the relevant actors and institutions are, and the economic and legal forces that affect and are affected by public policy. And then next, social and behavioral sciences. They apply social and behavioral sciences theory and methods to the study, practice, and thought of public health. They look at the relationships among social, cultural, and behavioral processes, health and illness, what society does and can do to promote health and prevent illness. They gain skills in survey research, statistics, behavioral measurement, ethnography, quality of life assessment, community-based participatory research, and cost effectiveness analysis. And then last, our generalist track. This is going to be the most flexible option to accommodate individual learning interests. So with this one, students satisfy the MPH degree requirements that are required for all MPH students, and then they're free to take an individualized set of electives or methods courses, either from this department, or they can cherry pick some from the other concentrations. Like maybe if you're kind of feeling drawn to health systems and policy, but you don't want to take all of their required courses, you can apply to Generalist and just choose the ones of health systems and policy that you want to take, and then, really make it your own. And they can also take them from other departments. So, so now back to that MPH Common Core that I talked about. These are the required courses that are required for any of those 3 tracks that I mentioned. So, so in the MPH Common Core, all MPH students pretty much take the PHI sequence courses, or public health interdisciplinary. And so what this is it addresses the foundational competencies that are required for the MPH degree. And it helps you consider diverse perspectives of public health, develop an appreciation for different disciplinary backgrounds, and you can become well-versed in both practice and research, and then you can decide what you want to dive into later, but you'll have some understanding of both. And yeah, the cross-cutting themes that are covered in this series are ethics and equity issues, global and local perspectives, communication skills, systems thinking, leadership and collaborative skills, and the evidence to action and back cycle. And yeah, this helps develop a common language for understanding public health concepts across all those programs. So these are your biggest classes. So in these 6 classes, you're going to be sitting with students from the Global Health MPH program and the Biostatistics MPH program, and all of them. And these are taught by faculty teams of 2 faculty. So there might be, in that faculty, there might be someone from this department working with someone from the epidemiology department, or it's an excellent series. A lot of students tell us that they think it's super important and foundational to the work that they do. And it's nice because they, on top of everything that I already said, they get to know students from other disciplines and other departments, and get to know faculty from other departments. And it's all part of that, that networking process, and, just building your community while you're here. All right, so this is the health systems and policy slide, but zooming out a little bit more broadly, those courses that I just mentioned, those PHI courses, you can see how those are laid out here, all in year 1, autumn, winter, spring, and then you mix in your other, your other courses throughout. So before I get into the specifics of health systems and policy, I'll just highlight what's relevant for all 3 concentrations. So in that first year, in addition to the PHI courses, we also have our seminar, and the seminar that's designed to exchange information about matriculation and works in progress. It's also a forum for you to meet faculty and learn about practicum, thesis, and capstone opportunities that you might want to be a part of. And then, so again, before I mention what the curriculum is, so for each of these slides, I put the required courses in bold gold font, and then if there are electives or methods, those are in italics. So for health systems and policy, those required courses are health systems and policy, health policy research, health economics, and health policy development and advocacy in the US. And then you have 3 electives or methods courses with this concentration. So then next, for social and behavioral sciences, we have strategies of health promotion, advanced qualitative methods in anthropology and public health, health program evaluation, and health communication and marketing for health promotion theory and practice. And in this one, you have 2 electives or methods, so a little less flexibility. And then for generalist, we have, like I said, 5 electives or methods. So you don't have any your required courses are the PHI courses. And then we also have, for all of those, we have our credits of Capstone or Thesis, which I will get into in a bit here. As you're researching this program, or any programs in this department, I encourage you to take a look at the curriculum pages. And if you go to this program's curriculum page, which is linked here, MPH courses and descriptions, if you click on any of those and you want to learn more about them, and about any of those courses, it'll take you to this page. You can also just go to this page, which is the department course listing page, filter out MPH. Just know that if you do MPH, it will show you also the online MPH program, which shows up as OMPH. You can see that on the right here. And COPHP is also an MPH program, but we call them COPHP in this, just for sanity's sake. Anyway, the point of this is, as you're deciding if this program is right for you, it can be helpful to you to know, take a look at the course descriptions, see if it's information that you want to learn. Also, when you're applying to us, when you're writing your statement of purpose, it can help you. It can help you, help us know that you're not just adding another program to cart as you do an application. If you tell us what about our curriculum excites you? Were there any classes that stood out to you? Why? If you're like, I was really interested in taking this health systems and policy class. I like it because X, Y, whatever your personal reason is. Yeah, it just can be one more thing to strengthen your application. Okay, so now we're going to move into talking about the major projects that are involved with this program. So the practicum is the experiential learning component of the degree. It occurs in the summer between the first and second year in the program, and it's a planned, supervised, and evaluated field-based experience, minimum of 160 hours of work, under the guidance of a site supervisor and a faculty advisor within a public health organization. The goals are to integrate, synthesize, and apply knowledge and skills from the classroom to a professional public health environment. You'll gain hands-on public health work experience and develop specialized knowledge in a topic of interest. And you deliver a written assignment, a visual assignment, and at least 2 student-generated products produced in the practicum setting for the practicum setting. All MPH students do a practicum, and every year we have a practicum symposium. I highly encourage you to check out that website. It's linked here. And I love that website too as you're researching programs, because every year they update that page. The folks from the dean's office update that page with examples of every single project from every MPH student, and they're organized by topic area of the project rather than by department that the student is from. So if you're interested in maternal health, you can look at some examples and then you can see what departments those students are from. They're not all from the same department. Some students choose to study air quality, and you'll notice that they're from different departments. So it can kind of help you realize what possibilities are out there for you and what paths you might want to take, and that there might be more than one. And yeah, we have more information on the practicum process here as well. And these are just some recent practicum project titles. I won't read the whole thing out because, again, time, but just sharing just some of the titles and then the practicum site. So this is literally where the students were doing the work. And I also want to say that a lot of people, before they join the program, they might feel a little freaked out because they're like, well, I don't have a relationship with UW Medical Center or Northwest Health Law Advocates. How am I going to get our faculty can help make those connections, and we have a fantastic practicum director who who helps pair you with a project that you would actually be interested in doing. So we have that support. Okay, so the next big project is the culminating project that happens right before you graduate. This is going to be a thesis or a capstone. This is conducted with mentorship and support from a faculty advisor. And similar to the last one, you'll develop specialized knowledge in a topic of interest, integrate, synthesize, and apply knowledge and skills from your MPH, and you'll produce a meaningful contribution to the field of public health. So thesis is your researchy option, capstone is your practicey option. So thesis is a research project designed to generate new, broadly generalizable scientific information about a public health issue, appropriate for publication in a peer-reviewed journal. It is not required that you publish, because even if you do a wonderful project, wonderful thesis, you can't control if they're going to accept it, but it must be appropriate for publication in a peer-reviewed journal. And, some of our MPH students do publish their thesis projects. And then the capstone is the applied problem-solving project designed to generate a practical solution to a public health problem. And it may not be generalizable, could be specific to one region, population, or organization, and it may not be appropriate for publication because it could be confidential to a host agency. And we do have some thesis and capstone examples on our website if you would like to check those out. And then also our HS Pop News page will share stories about cool capstone and thesis work that folks do. So I encourage you to check that out as well. And then these are some sample titles, which again, for the sake of time, I need to move on. I've been adding more slides recently without removing things, and I always go to the very, very end, and I want to honor your time and Q&A and all that. So I'm going to move on from this slide, but you can check it out later when I send the PDF out. So before I get into career outcomes, I want to share a little bit about the career services that our students have available. So through the School of Public Health, we have a fantastic career services department led by Darren, who's amazing. And the career services folks offer one-on-one advising, job search resources. They do tons of panels, which it's impressive how many panels they're able to host with alumni across the School of Public Health. And that might be like how to find a job in, government public health or in nonprofit public health, or how to make the most of your resume, or how to manage burnout, or as you're applying for jobs. They talk about working in a bunch of different job sectors and just kind of help give you an inside look. And then I also, again, want to mention the student organizations and public health networks. Not really directly a career service, but it's another way to sort of just like build your network while you're here to make you more likely to land a new job when you graduate, if that's what you're trying to do. UW also has a career and internship center more broadly. And then this program, we offer opportunities to network with alumni. We have a private LinkedIn group that's just for current students and alumni. And then we also share job postings. And this map on the right, this is just a map from a recent survey of alumni of where they've landed in the US. So, if you're getting close to graduation and you're thinking about moving to Boston, we can take a look at our most recent alumni survey, filter for the people who said, yes, I would be happy to connect with students and alumni if they want to reach out to me. And then we can sort of help make those connections if you want to connect with folks in this network. And yeah, so our alumni work as public health practitioners, researchers, and leaders in universities, research and policymaking organizations, the healthcare industry, government agencies across the US and around the world. In our most recent survey, 98% were employed in public health or related fields. And this is UW's longest running Master of Public Health program. So we were founded in 1969. We actually predate the founding of the University of Washington School of Public Health by 1 year. So we've graduated over 1,000 people. So like I said, very robust alumni network to be a part of. And on the right here, we can see just some job sectors where folks reported that they were working. And with what's happening in public health, this, I bet this pie chart is different now. We'll get updated information when we do the alumni survey again in the fall. But you know, as of fall 2024, this is where people were working. 23% were in academia, 21% were in government, 22% in healthcare organizations, 14% in nonprofit organizations, 13% in private organizations, and 7% were self-employed. And these are just a few job titles. I won't read the whole slide out, but just know that this is split by folks where a master's degree is their highest degree, and then folks that also have doctoral degrees. So we have program manager, project director, outcome and evaluation analyst, research coordinator and field operations lead, quality improvement manager, community research manager, tribal liaison, and then we have medical officer, director, director of clinical operations, senior research scientist, professor. Yeah, and I highly recommend that you check out our career page because there are a lot more job titles shared on that page. And that page is split by folks where the MPH is their only graduate degree, folks that have an additional master's degree, and then folks that also have a doctoral degree. So there's one more component of splitting, if that helps. And just more titles because there are so many people to share. It's hard to choose which titles to share. But the main thing that I want to highlight is that, the theme of leadership here, it's gratifying for us to see that people go on and they actually have these positions in public health where they're able to, influence public health and make a difference and have some impact. Okay, so tuition and fees are based on the current academic year, what we see here. So this is always subject to change. But the way that I split it is we have Washington resident on the left and non-resident on the right. This is a state-funded program. Not every MPH program is state-funded. So some of them are fee-based. This one's state-funded. So we have in-state and out-of-state tuition. So in bold where it says total for year one, that's just where I added the tuition and fees for 1 year. And then I multiplied that third line, that total by 2 to give you an approximation of what the degree would cost. And then we have a breakdown of what those fees are. The only ones that might not be obvious, IMA is the Intramural Activity Center, and UPass is that gets you on the light rail, like our train. It also gets you on the bus, water taxi, if you want to take a water taxi. So yeah, that's how that all shakes out. So for funding, the majority of our students finance their degrees with a combination of loans and assistantships. That could be research assistantships, teaching assistantships, or other staff assistantships working in departments less related to teaching or research. Like there are assistants in that career services department I mentioned. There are other, just operational assistantships that folks can work. And these can be a great way to help pay for the degree. So depending on the assistantship, they all vary in how much they pay. That depends on the length of the assistantship, like how many weeks it is. Is it a quarter? Is it a year? Is it 5 weeks? They vary. But yeah, so they help pay for the degree. They also often have a stipend and health insurance. So yeah, it can be a great way to cover the degree. I encourage you to check out this link, check out the cost and aid page because there's too much to say about assistantships right now. But they're a common way that students fund their studies. But they are jobs, so you need to be you need to be offered admission and then accept your offer officially in the system before you can even apply to these. So you can't apply to them as a prospective applicant because the people who are hiring want to know who their actual applicants are. So they want to know that you are joining us and, you know, that if they hire you, you will be the person that they will work with. But basically, the earliest that you can apply to these before you join us, like say 2026 fall, that's when you would come. The earliest that those would be posted would be spring of 2026. So basically, you can apply in the spring for fall, but then they're also posted all the time, just as needed. And we share those from the program and also the School of Public Health. They send those assistantships out to the listservs, or you can go on the assistantship pages to look at openings, but just know it's not something you apply to now. It's a future thing. We also have the H-Seat Award, which is a $5,000 award offered to one student from each program in this department. There is the School of Public Health's Master's Fellowship Award, which is, I think, generally about 6 students, but it varies. There are other sources of funding based on your area of study or identity factors, so that's a page to check out. And the ASPPH offers a helpful guide for financing your degree, and then so does the UW Graduate Funding Information Service, or GFIS. I really like those pages as you're figuring this all out. And you might also want to contact the Office of Student Financial Aid just to see what's available to you in your situation. So timeline. September 1 is when the application will officially open. That's when you can go into the application portals and click Add to Cart. Please do not do that before September 1. I'm going to talk about the essay prompts and stuff. There could be minor revisions that happen between now and then. So if you click Add to Cart in the application portals before then, you might accidentally get, an old version of the application, or you might get accidentally looped into the previous year's application cycle. So please don't waste your time or money doing that. Just wait till September 1 to hit Add to Cart. However, leading up to that, you will see the prompts that I talk about today. You can also find those on our admissions page. So if you want to start writing your essays now, you can do that. But they're all on our website. So that being said, the deadline to hit submit on that application is December 1. That's not the deadline for it to be verified in Sophis. It's just the deadline for you to submit is, midnight Eastern time, not Pacific time, Eastern. So New York time, midnight on December 1, like that night, not that morning, if that makes sense. You have all day on December 1 to hit submit. And then mid-February is when we convey admissions decisions to the applicants. So, that's when we let you know if you have an offer or not. And then April 15th is the deadline to let us know if you intend to accept your offer and join us in the following fall. Then classes always begin in late September. So you apply in the fall for the following fall. And all that being said, I'm going to, next I'm going to talk about different tips, but, I encourage you to do as much of this as close to September 1, like closer to September 1 than December 1, because there are a lot of things in November, December, that might get in the way of you having peace and sleeping. Like if you're waiting for your letter of recommendation folks to get back to you, and you wait too long to put their email in the system, and then it's like Thanksgiving week and they're gone, or, it's finals of their quarter or semester, they might not be able to write you a beautiful letter. So please do these things early, the preparation early. And don't wait until December 1 to apply, because you'll be stressed out. And you will hear me say that again, because I'm the person that people email as they go through those stressful situations, and it makes me sad when people are stressed. And so I want to warn people early to do all the prep they can ahead of time. But moving on, so the minimum admission requirements are set by the UW Graduate School. So they require a bachelor's degree from an accredited college or university in the US or its equivalent from an international institution, and a minimum of a 3.0 GPA on a 4-point scale. And this is for the last 60 graded semester credits or the last 90 graded quarter credits. It might be your entire undergrad degree if you've taken more courses, or if you haven't, another graduate degree, it might be some of both. But we have a grade calculator that you can use to calculate your GPA if needed. So beyond the minimum requirements, as we look at our holistic review criteria, I'm going to talk about, what's important to our admissions committee, what we look for in applicants. And none of these are make or break factors at all. What we do is we weigh all of our applicants fairly and equitably with a standard rubric. That way nobody gets if I'm a faculty reviewer, I'm not favoring someone because, in the back of my mind, they remind me of a younger me or something. Everybody's being weighed fairly and equitably by multiple people. But, so none of these are going to make or break your application, but this is what's important to us. So first, we want to see a passion and aptitude for public health. And this is conveyed through both your written statements, your resume, what you've been doing with your life up until now. We also look for strong academic background and performance. This is a rigorous program, so we want to know that you can succeed and thrive when you're here. Average GPA of students who are accepted to the program is 3.57. Again, not a minimum cutoff. There are places for you to explain, if you had some quarters or semesters of lower grades, was it a life experience? Was it just that topic was difficult for you? Yeah, there are places for you to explain that. But like I said, grades are important because we want to know that you will, succeed when you're here. And I mentioned those letters of recommendation before. So this program requires 3 letters of recommendation. And those can come from professors or supervisors. We don't have a hard and fast rule for a number. It's not like 2 academic and 1 work. It's, everybody's experience is different. And the people who can speak to your, the benefits of working with you as a student or in work, it's unique to everybody. So the important thing is that you have at least 3. And then work and volunteer experience, does it match up with what this program offers? These 2 are connected. So your past work and volunteer experience and education, and then what this program offers, and then if the career goals make sense. So if we feel we can set you up for those career goals. So when you apply, you'll complete 2 applications so one will be through Sophis and one through the UW Graduate School. And I'll get into the details of what goes into each one. And, you might be curious, why 2 applications? So Sophis is used by most of the top schools of public health in the US. It's like a one-stop shop for all things admissions and applications. And you can apply to as many programs as you like, and you don't have to repeat most sections. So that's a benefit. So most of your application materials will be submitted through Sophis. So your essays and letters of recommendation and that stuff. As a public university, however, we have to adhere to state law, which involves student and applicant records going through our grad school. So, they're required to have that application for every applicant in our, what we call the My Grad application system or SLATE application system. The main thing for you is you're applying through the grad school's website. And and, just giving us the information that we need to have your record on file. But I like to think of it like the SOFIS is the primary, and then UW grad school is the supplemental. I think of it that way just because you're spending most of your time in SOFIS, uploading the most documents in SOFIS. Okay, and then I mentioned those concentrations that we have before. Please apply to only one concentration and please make it match on both portals. Same thing with your name and email address. So on SOFIS, if you're going to apply to Generalist, please also apply to Generalist on the UW grad school application. If you go by Bob and Robert, please pick one and make it match on both portals. If you have an email, please don't like do Yahoo and then Gmail or whatever. It's not a huge deal. It's not make or break. Especially the name and email. That's less of a big deal. Mixing up your concentrations, that's a bigger deal. Accidentally applying to a completely different program too, that's also a bigger headache and not a guarantee that we can work in the back end to fix it. Like if you apply to Generalist or say social and behavioral sciences on one, and then in the other application, you apply to the online MPH program or to a different department like the global health MPH program, we can't just go in and see that application in that other program. Like we only have access, each program only has access to its application. So then you would have to go back in and reapply, and that's a headache. So just please make sure everything matches up. The name and email is more just for our sorting, so that when I'm like making a list of applicants and I can see like, oh, these people have applied through SOFIS, I need to email them to say, make sure that they also apply through UW grad school. It just makes a headache if the names or emails don't match, but it's less of a big deal. Okay, so SOFIS has a fee of $150 for the first program that you apply to, or $60 for each additional program. They do offer fee waivers through their website, not administered through me or us at all. Please go to their website. Please apply for these early because they have a finite amount of waivers every year, and they consistently run out right around our application deadline. So when people are actually finally going in and clicking request waiver, sometimes like a lot of folks' applications will get stuck in SOFIS and then it's no fun and they have to pay for a fee that they shouldn't have to pay for, that they would otherwise qualify for. So please go in and start your application, as soon after September 1 as you can so that you can request that waiver. And then the UW grad school application is $90 for every program that you apply to. Also, fee waivers are available. It's not a finite amount. With this one, it's more of a big deal that you request the waiver at least 7 days before the deadline, because a human has to go in and see your request and then pay the fee for you. Can't be reimbursed. They pay the fee for you on behalf of the school or the department. And they don't work 24/7 and they don't work weekends. We're kind of 9 to 5-ish. So Monday through Friday. So yeah, please give those humans time. And please check the UW grad school waivers before you check our department waivers. Like our department's just supplemental money to back up the folks that don't qualify for the grad school. But these are the only ways to get waivers for the graduate or for the application or through these routes. Okay, so starting with the easy one, the grad school supplemental application. You report your prior schools attended. You upload a PDF of your unofficial transcript, which just means that you have it. So it might say official. It might be, a piece of paper in front of you. It might be something that was emailed to you. Even if it says official, it's unofficial if you have it. After you're offered admission, then you can worry about the whole getting your institution to send the transcript to UW. Like that's what an official one is. But you don't have to worry about that right now. Just a PDF upload of your transcript and then your SOFIS application ID. So we do this so that you don't accidentally go through all the steps, apply, and then realize, oh, I also have to spend $150 on a second application. I don't have that money. Now I'm out $90. We don't want anyone to go through all that. So on both applications, you have to put in the application ID of the corresponding application. Okay, so now for the SOFIS. Here you'll upload transcripts. You'll order official transcripts through SOFIS, and there's a manual transcript or course entry section, which takes time. You literally type in verbatim every course on your transcript as it is written. Don't try to write it like clarify it to make it make more sense. Like literally write it as it is written on your transcript. You can also pay somebody from SOFIS to do this for you, but you then still have to go back in and check their work and make sure they did a good job and do edits. So up to you if you want to go that route. I mentioned those 3 letters of recommendation. What this is you don't upload the letters, so the people don't send them directly to you. What happens is you put their name, email, you can write them a short message in your SOFIS application. Like you can add them to your application, and then the system pings them to upload their letters. So again, please do this one as close to September 1 as you can. Give these people time to praise you and to remember you. I encourage you to reach out to them before you put them in the system to ask their permission. And when you do this, it's a good idea to remind them who you are, you know, when you took their class or what you worked on with them, what projects you were involved with. Yeah, help them help you. And like I said, like don't wait until the end because it's stressful for you and for them if they're having to go in and write this for you like really quickly over the Thanksgiving holiday or at the end of the quarter or semester. Yeah. You'll also upload a updated resume or CV. You have the option of submitting GRE scores. It's absolutely not required, but some people do, especially if maybe they had like lower grades and they want to show that, you know, their undergrad grades don't reflect their current potential to succeed in the program, but not required. And then if English is not your first language, you might need to provide test scores to show your English language proficiency. I highly recommend that you check out the grad school's requirements around this just to see is required of you. Maybe you don't have to do this, but they have the specific rules written out on their page. And then our written statements. So these first ones here are required by all programs in the University of Washington School of Public Health. And I mentioned this before, but these might change in the next month or so. So, you know, you can take a look at our website at these prompts, start typing them out, but just know they might change before September 1. And I will try to email everyone when we officially know that we have the most revised updated questions, but you know, just with things that are happening like federal regulations, we're just looking at everything, making sure we're going by the rules, and evaluating that right now that the school year's over. But anyway, so these first ones are required by the School of Public Health. You'll upload these only one time. So if you apply to more than one program at the UW, one MPH program, just know that you'll only upload these once, and then as you add more MPH programs to cart, let's say, you won't see this prompt again. So if you apply to us, you'll upload these, and then say if you apply to Global Health also, when you're in your second application, you won't see these UW School of Public Health ones again. And then everything else is required just by this program. So every program will have their required questions. And those essays are only seen by that program. So I can't go in and see what you write in your online MPH or COPHP application or, well, I can because I do work with those programs, but I can't see what you write in your epidemiology MPH application, for example. So for each one, you can write to all of us and say, you're my favorite program. Here's why. Yeah. You'll also share your UW grad school application ID, and then areas of interest list. So this is just like a comma separated list, like maternal health, environmental health, occupational health, addiction, homelessness, that just a list. And then we have optional questions down here, which are the academic preparation question. If you are going to be in a concurrent or dual degree, like if you're doing an MD MPH or MSW MPH or something like that. If you have any fellowships, and then if you would like to be considered for the HSEAT award. So getting into those statements, I realize it's 154, so I'll try to go quickly. You have your personal history statement, which is the narrative about your lived experiences and obstacles you may have overcome, how they have guided you towards public health. And then our equity, justice, and anti-racism statement, which is how you might contribute to our EDI efforts or learn and grow in these areas, and in anti-racism during your time here and in your public health work post-graduation. And then this program, so HS Pop MPH program, your statement of purpose. This is like the big one. This is why this program. You can further describe, in addition to your resume, further describe your education, prior work and volunteer experience, professional career goals, and why this program will help you meet them. I mentioned before, like you can also mention, like, what about our curriculum excites you? Are there research centers in our department or in the School of Public Health that you're excited about? So, help us place you in this program, help us visualize it. So this is like the main question, I think. And then academic preparation, which is just optional, just kind of more space for you to share if there's anything in your transcript or resume that you want to share that is not there, sorry. That would indicate preparation for the writing or quantitative demands of the program. Like maybe you were in you read additional coding books, or maybe you have a blog or something like that. Yeah, just additional space if you need it. You might also say these things in your statement of purpose or in your resume, but yeah, some people need more space. All right, so wrapping up the presentation portion. So why this program? Why the HS Pop MPH program? We are training the next generation of public health leaders. Our curriculum emphasizes interdisciplinary study and work with small class sizes and active learning styles. We have an extensive alumni network with over 1,000 alumni. We have a foundational commitment to equity, diversity, and inclusion. And our faculty are leading public health researchers and practitioners with strong community connections. And we're part of the top-ranked UW School of Public Health, which consistently ranks in the top 10 public health schools in the nation, according to US News and World Reports. If that kind of thing is important to you, you can go to School of Public Health's rankings page. They have a bunch of different publications and ranking sites listed there. And then also Seattle is a great place to live. It's the largest city in the Pacific Northwest. I'm not from here. I'm from Boston, and then Ohio before that. And I do not want to leave. I've lived here since 2020, and I just think it's beautiful. Oops, sorry. This is my busiest slide. On the left, we have pictures from campus. Like in the top left, you have Rainier Vista, where you can see Mount Rainier from campus when it's not too cloudy out. And we have some, if you're walking around our Health Sciences Education building, and the HRC building, it's a nice campus. And then Seattle stuff on the right, we have the Puget Sound with the famous Seattle ferries and the Olympic Mountains. And, there's a picture in the middle of the Olympic Peninsula, in the Space Needle, whatever. Seattle is I really like it. It's a great place to live. So if you have questions about, ferns and moss and what I think are heavily exaggerated myths about rain, I'm happy to also talk about that stuff. Okay, so if you have to jump off, I want to make sure that you see my email here, hservask@uw.edu. You can email me your questions. You can also book a Zoom appointment if you want to talk one-on-one over Zoom, whichever is better for you. And we have our news stories down here linked. That will be in the slides. Yeah, feel free to type your questions into the chat. I see one, and I'm going to answer it. But feel free to type those in while I'm talking. How will you contact/announce when the written statement prompts are solidified if this happens before September 1? So I will send out an email to anyone who attends like info sessions or is on our email list. If you signed up online for our email list, you'll get an email saying like, check out our admissions page for the most up-to-date prompts. I believe it will be in the next like couple weeks, like mid-July, that it's like for sure set in stone. And apologies, usually we have it set in stone earlier in the year, but 2025 has been a little crazy, and we're trying to do our best to keep things as equitable as possible, stay true to our values as a school, maintain our values in the work that we do and in our classrooms, but to also follow the law. Okay, so next question. Do applicants normally have full-time work experience? Is it common to go straight from undergrad into this program? It's a mix of both. Some people have like 2 to 3 years work experience. I'd say that's the most common is 2 to 3 years work experience, but we also have, this program does let in folks right after undergrad as well, if we think that they, from their statements and the resume, that they're prepared and ready. It might not just be full-time work experience. It might be some part-time. It might be sporadic. There might be some volunteer experience that we consider. Yeah, it's a mix of both. If you apply sooner than December 1 deadline, should you expect to hear a decision before mid-February? No. So after the deadline, we meet with our admissions committee. We kind of train on like bias and stuff like that, and make sure everyone's familiar with the rubric for rating everybody. And then they rate everybody, and then we go over all of the people, and we have our list, and then everybody gets the answers all at once. What do you specifically look for in applicants coming straight from undergrad? So I would say like things that we look for in everybody. We don't have different stipulations for if you're undergrad or or if you have lots of work experience or an additional grad degree. I can go back to that holistic slide. If you have some work experience, that's great. If you have volunteer experience, that's great. If your courses prepared you for things like public health, like that's fantastic, but not everybody comes to public health grad programs from a undergrad in public health. Like some people work in a field and then realize, I want to go further upstream and fix the issue. That's what lands them in public health. That's how a lot of people discover it. So if you can sort of make those connections in your written statements of what steered you here and why you're ready for this program, then that will certainly help you. Also, there's something that some people do to strengthen their application if they're worried about their grades, or they're just not sure about like which they want to bolster their experience. Like some people will take additional courses in like algebra or stuff like that to sort of bolster their quantitative performance, or show us that you're a good writer. Like writing is very important to this program. Health communication is important to this program. There's a lot of writing involved. So really, as you're writing your written statements, think about that. Think about crafting these essays in a way that is clear and easy to interpret, and and show us that you can do that as a student and as a public health practitioner or researcher. And I mentioned that blog thing before. Like if you're a writer, but maybe you didn't ever have like an official public health job, but you have like a food blog, we're also curious about that. Like these things a lot of these skills are very translatable. And that's kind of what that additional question can be for. Any other questions? I know we're over time. Anybody? Okay. Well, I'm going back to this slide that has my email, so feel free to send those to me via email, or you can book advising appointments. You'll get a follow-up email from me today with the slides and just some additional links because I'm always sending people links. But yeah, I thank you so much for joining me today and for considering this program. Hopefully we sound like a good one to you. And I know that, spending part of your day with me is a big ask. Like I don't even watch TV shows that I am absolutely obsessed with live. So thank you for spending an hour with me. And please stay in touch. My husband just came in here. Please stay in touch. And I will be your person that will answer your questions from now until after you submit that application. So yeah, I'm looking forward to answering more questions as they arise. Also, please take a look at our social media and our department's news page. We regularly share stories about what our students and alumni and faculty are doing in the world of public health. And it might just be another thing that you can either cite in an application, or maybe it helps you decide if this program is right for you, if you feel inspired by these stories. So check that all out and stay in touch. And I'm going to say goodbye now. So thank you, everyone.